Thank you so much for taking the time to join us tonight and for our PiezoWave Open Forum. And I'm really excited to have Dr. Katie Ellis talking to us today. We were just discussing that she's recently moved more from a rehab into a general practice situation and has been using her shockwave very actively. So she is going to give us some information about and tips and tricks about incorporating shockwave into the general practice situation. And with that, I will hand it over to Dr. Ellis.
Cool. Thanks, Cindy. Yeah, happy to be here and appreciate the time that everybody's taking to listen and hopefully learn a little more. I'll try to keep it pretty brief and general, but give some ideas of how we can incorporate this into general practice, because at least in the area of practice that I'm at, this is predominantly in specialty practices. So trying to incorporate that into general practice and get a lot more shockwave on a lot more patients. So just kind of a general, why are we talking about shockwave? Why does it matter to general practice, especially? We just have a really increasing need for multimodal pain management. I frequently have owners asking what alternatives there are. Everybody wants a supplement. Everybody wants something besides a medication that they can use. And a lot of the statistics are telling us that at least 1 in 4 dogs are diagnosed with osteoarthritis in their lifetime. And that's what I'm using shockwave to treat the most. We'll talk about other things we can do with it later, but we just have a big need, and it's a void that I think we can fill. I avoid prescribing medications as long and as often as I can. I think there's a time and a place for that, but just having that something that we can incorporate that is so safe, easy, I think it's something that we can utilize a lot more in general practice. We're obviously also seeing a lot of older dogs. The golden retriever in this photo here is 16 years old. So we never used to expect them to be around that long, but with advancements in medicine and quality of care, we're seeing these senior dogs that need help more than an NSAID, more than a Librela, and we have to have ways to treat them alternatively that I often find more effective than those things anyway. And kind of like I already alluded to, there's not a lot of access. Like, this is not a common modality. I frequently have to explain to owners what it is, to staff what it is, because we just don't see it a lot. And I think it's getting more common, but not as much as it could or should be. And a lot of times we're having to refer to rehab practices or specialty facilities because they're the only places that have it. So being able to have this in our practices, I think, is a great option. Starts with owner education. That's, I think, the biggest part of implementing this into general practice for me, at least. When I was in a rehab practice, people were coming and searching out alternative modalities. They were there for acupuncture, for physical rehabilitation, for shockwave, for laser therapy. When we're seeing general practice patients, they aren't always as actively pursuing those other options. I do have a lot of people who ask me about other options, but not as commonly as when I was in a rehab practice. So I start by educating owners, trying to get them on kind of an osteoarthritis protocol, if you will, and start by saying it's a non-invasive modality that helps a lot in pain management and can rapidly speed healing processes. One of the things I feel like I have to explain the most is that it is not a shock. A lot of people hear shockwave and they're scared, but I tell them that it is not painful. It's extremely well tolerated. Their dog may be sore for a day or two after, but other than that, I usually just very quickly start to see improvements. A lot of owners I find are impressed with how quickly they're seeing their dogs improve after treatments. It's it's something that I almost always see at least some level of improvement with pain or function. So I also tell them it's sound waves, since we're talking that it is not a shock. And again, we're stimulating healing, reducing inflammation, and improving pain. One of the most important things, I think, also is team training. So we're educating our owners to convince them that they need it. And then we also need our team to do the same. And that's all levels of the practice. So obviously starts at the front desk. They're going to be getting a lot of the questions. They're going to be getting the phone calls because hopefully when we're offering a new modality, we're advertising, we're having new clients come in to pursue that since it is hard to access in other places. So we want them to have these basic understandings that they can explain to owners in simple terms. What is Shockwave? How could it help? What potential cases? Obviously, they can't recommend treatments or anything like that, but to have a basic spiel of what it is, how it can help, and how they can get these patients in for an exam to see if it's the right tool for them. So understanding intervals is also a big thing for the front desk. They're fielding the scheduling, and I often put in like a general protocol of how often we start, how often we taper our treatments so that they know easy scheduling. Hey, we did it once this week. This is our first treatment. We'll probably do a second and space after that. So, a lot of information for the front desk. I think we don't always expect them to understand or be able to relay treatment processes, but I do think this is one that's simple, straightforward, easy to explain, and relay to owners. Our biggest tool, I think, in shockwave therapy is our support staff. It's a very technician-driven appointment. We have that almost in every single appointment that we provide for shockwave. It's the technicians or even assistants doing it. The biggest part of that is their anatomical knowledge. And I'm happy, especially the first time I'm treating a dog, to do that alongside a technician or assistant to show them exactly the location, help them with palpation. But they're great. I mean, they're touching dogs half the time more than I am. So I totally trust my support staff, and getting training with them can be really helpful. And I think they like the autonomy of being able to do that on their own. I think they enjoy being able to provide a service that is effective and that they can do without me. So I'm probably staying out of their way, and they appreciate that. Um, Usually I'm only having one staff member who needs to provide treatment. Like dogs, cats tolerate it so well that I don't usually need multiple staff members participating in these treatments, which can be helpful just from an efficiency standpoint and from really return on investment. So we're not using a lot of staff power to get these treatments done. It's easy, it's fast, and they can get it done without a doctor. And we all know, particularly in general practice, I think there's more of a push of the value of doctors' time. In rehab practice, we did take things slower and saw a lot fewer patients per hour, but I do find that in general practice, it's all about speed and efficiency. So having the ability for support staff to do that, I think, is extremely important. They're also the ones maintaining the machine. So they're cleaning standoff pads, they're wiping down the gel, making sure we have towels, and that can be really effective in making treatments go faster. Obviously, veterinarians, big part because we're the ones prescribing this treatment. But coming into a practice that didn't have this, it's also educating other veterinarians in the practice and letting them know what we should be using this for, when we should be recommending it, and incorporating it into a basic osteoarthritis protocol. I went to a talk recently at Western about all the different options and really the importance of creating an osteoarthritis management protocol. And I think that Shockwave is something that we can easily implement into these protocols to provide more comfort for our patients. Financial considerations. Obviously, this is a big part for us as veterinarians, whether it's practice owners, practice managers, the people who are paying for treatments. Obviously, like it's scary. The initial investment is large. All of our equipment is. That's not exclusive to this. It's a part of buying a powerful and effective piece of equipment. But outside of that initial investment, the maintenance is very inexpensive. It really pays for itself, I'm finding, so quickly because it is a fairly expensive treatment that we're charging for. And because we're doing it frequently, we're getting that return on investment fairly quickly. Even if we're doing just 2 to 3 cases a week, we're starting to pay for that investment on that machine. It increases our client retention because they are coming back. A lot of these osteoarthritic dogs I'm seeing like once a month on a maintenance protocol. And those are dogs that if we were only sending home an NSAID or gabapentin, or they were coming for their monthly Librela, we're just not seeing them as frequently or treating them as frequently as we can, getting them under control with Shockwave. And kind of to that point, the chronic cases, we're just seeing them more frequently. Something's painful, it's coming in sooner. I think it increases client compliance because they see results so quickly and effectively that they're coming back for treatments instead of getting on that Rividel cycle and we don't see them for 6 months or in a year because their annual exam is due. So big, big opportunities, I think, for return on investment in this machine. And kind of like we talked about earlier, appointments are short. These are not long treatment protocols. So they can get them done quickly. It only takes technician time. It does not necessarily need doctor time. And you can get them frequently through the door. I know of some different practices where they're just setting a special time aside in the schedule. This 2 hours of the morning is when we do Shockwave. And it's quick, it's efficient, it's getting them out, it's assigning a technician to that, and honestly making a lot of money because at the end of the day, this is a business and we all have bills to pay. So if we can do something that's effective but also produce income, it's just another bonus. Straightforward setup. So it's easy to get this into the practice. It requires very little space. You can kind of see an example. That's what our little setup looks like. We've got the machine on top, and we use that kind of storage basket on the bottom as a place for standoffs and gel, but it's mobile. It doesn't take a ton of space. It uses a regular outlet, so no special setup required there. And unlike our class 4 lasers, we don't need an enclosed room. We don't need eye protection. It's a lot easier to manage to use this in a busy practice setting, even with limited space. We only need gel. We don't even clip our patients for this, so we save that time. I know that used to be a big part of Shockwave was clipping hair, and especially our sport dogs, our show dogs, people don't want to see that. So we do not need to clip, and just a thick coating of ultrasound gel works. When we purchased the machine, we had a great demonstration. I will say, like, PiezoWave does a really nice job coming in to show veterinarians, support staff, front desk, anyone who wants to learn about it. And they also provide a really great kind of treatment guide that has basics about standoff gel sizes, when to choose that, when to increase the strength of the pulse. So I felt like all of that was very helpful and made it very easy to use the machine quickly once we got it. Case selection. Obviously, we all want to know, what can we use this on? And like I said at the beginning, osteoarthritis management is my biggest use for this. I know there's a lot of controversy around Librela, but it is not a tool that I use very frequently. And I have a lot of patients who cannot have NSAIDs, whether that's GI upset. I live in Southern California. We see all of the doodles and the Frenchies with the IVD and everything else that they love to get. So a lot of time we have NSAID intolerant patients, patients with chronic kidney disease, things we don't want on NSAIDs forever, hepatopathies, things like that. So to have a tool that does not require pharmaceutical intervention, I think is one of the most valuable assets I can provide in improving patients' mobilities. Post-op orthopedics. So we do them post TPLOs because there is research demonstrating that this improves bone healing, which is why it's also helpful for fractures. But my general practice in particular has a mobile surgeon who comes in. So before that dog is recovered, we're also performing TPLO treatments and doing that as a part of their follow-up radiographs. So easily incorporating this treatment into follow-ups that they were already coming back for. Just another option, A, to improve their healing and really improve patient care, but another form of revenue when they're already coming back for radiographs, check-ins, things like that. Tendinopathies. I saw a lot more of those when I was in rehab practice, but a lot of the sport dogs are coming in with shoulder tendinopathies and things like that. And I tell them that Shockwave is my number one treatment option for that. And then it sounds weird, but skin, we can do things with skin because we're promoting healing. So while we do cover with like plastic or a glove before we put on that gel, like granulomas can be helpful or help treated by these shockwave treatments. So can be really effective. And it's things that I wouldn't think about initially when I'm thinking about shockwave. Just as a fun example, those are my three kiddos, but the dog on my right is 15 years old in this video. She had bilateral TPLOs, lumbosacral disease, and chronic kidney disease. So she was not an NSAID dog. And this is her after starting shockwave treatments. So she's not as fast as she used to be, but she can hang with the younger boys. And I think that's pretty incredible to see. That's what I love to see. Yep. There we go. General treatment protocols. So obviously, a lot of general practitioners haven't done this a lot, potentially, unless they're coming from more of a rehab background. I always start my treatments initially more frequently. My general protocol is twice a week for 2 weeks and then spacing after that. I know there's a lot of variables in that and how people like to perform treatments, but that's my go-to. And a lot of times we're reducing these treatments to like once a month, especially the osteoarthritis dogs. I've had some lumbosacral dogs that I'm treating who come in every 6 to 8 weeks, and owners love that. They love that they don't need to come in frequently, but when they do, they're going to get a treatment that works and makes their dog feel better and drastically improves quality of life. So it's easy to do, it's easy to follow these protocols. And again, the guide provided by PiezoWave was super helpful for me to start to feel that out. And the more frequently that I did it, the more I was kind of fine tuning to what I see and what I prefer and what works for my practice. Other huge bonus, no sedation required. I have only one dog that could not tolerate treatment on the lowest setting. It was a very, very sensitive dog. Other than that, I have no problems with fear of the sound, with not staying still because of pain, because we're able to alter our treatment intensity so much. I just never see problems, and it's really helpful. So, we have dogs that are difficult to work on, and I rarely have a problem treating a dog with shockwave. I have found with like things like laser, those treatments can take a very, very long time, and dogs don't always want to sit for that. Cats don't want to sit for that. So having a faster modality, I think is really helpful. Follow-up care, another part of incorporating this into our practice. I want my staff to have a knowledge of about, my kind of protocol twice a week for 2 weeks and then spacing it after that so that they can set up appointments for me, scheduling ahead. I know some practices elect to do like packaging, some do individual sessions, but putting it into like a package can make it easy to schedule in advance and hopefully increase owner compliance. But getting those on the books, I think, is helpful. And then I always have, especially after the first treatment, a check-in a couple days after, like, hey, how's Fluffy doing? She might have been a little bit sore, but should be improving by now. If you haven't already scheduled it, when would you like to come in for your next treatment? And do you have any questions? I think follow-up can sometimes be a lost art, especially when trying something new. So I do try to always follow up with first-time patients a few days afterwards, and I think that helps a lot. So that's just really big, brief overview of how we can get more shockwave into our practice, how it can be helpful, and why we need it. So I'm happy to take questions about anything I can. Oh, Cindy, I think you're muted, but I see your mouth moving.
Excuse me. I was like, of course I always have questions. And I have to laugh because they're written on the back of my room key because I didn't get a notebook out.
Hey,
Um,
whatever works.
so one of the questions that I've been running through when talking to some of these more general practice people is can we or do you give a very simple exercise um, program, one or two strength building, blah, 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 with these dogs when they go home. What do you feel about that? Is there any compliance or?
I would love to. I would say, obviously, when I was in a rehab practice, every dog was getting an at-home exercise
Exactly.
program. And I was fortunate to work at a practice where we had Physiotech or whatever that computer program
Mhm.
is to easily send home exercises. Where I'm at now, it's a little more challenging because we don't have that. I will say basic things, but that's honestly somewhere I'd like to improve in practice. Like I think it's more valuable than we even let on, and I think that's something I could do more now. Obviously in general practice, we're so caught up, at least me, especially being a little bit new to it, caught up with speed and more things going on at a time, and maybe I'm not taking as much time to do exercises for everyone, but if I can incorporate that, I think that's such a good idea. And I think people want it. I think it's
They do want
useful
it.
and people want to be able to help their dogs and they just don't know how.
Yeah, I mean, I guess for the general practice group, one of the things that I thought when I was talking to Dr. Owen, like two exercises for each joint
Yeah.
treat for, to just that even, you can on one page that the tech can, you know, give
Yeah.
out or talk to. Often I find when we get in rehab, we get into, extensive, you know,
We got a little bit overzealous.
well, yeah, and we try three of these, four, but um, and even simple things that you can do while the
Oh yeah,
dog's
weight
sitting on your lap.
shifting. Yeah, easy
Yeah,
stuff. And even instructions, I think more like walking instructions. Like people don't know how often, how long, when to walk their dogs. Like I think that's an area for improvement, even in my own practice.
I have a group in Texas who purchased earlier this or the end of last year, I should say. I've lost all track of time. Um, and I love the Shockwave block of
Yeah.
appointments. I hadn't thought about that,
Hmm.
but then you're kind of your or the way any of us work, we can kind of be in the zone.
Yeah, absolutely. I know I work better like that.
Yeah, that's something to definitely suggest that I haven't been. So,
Yeah, hopefully
super,
helpful.
super. No, very helpful. And obviously we will share um all of your knowledge and suggestions. I I do have trouble with the front desk. I have to say that.
And they're
And
the first
I
in line. Like we have to get them on board.
Yeah, we brought the front desk back in at the place I was in Nevada. Um and I'm like, you guys have to like not say you have to at least recognize, hey, mention to the doctor, remember Shockwave,
Oh,
when you
yeah.
see something limping in the front door.
Yeah.
Uh, but um, super useful. Anybody else have questions, ideas, thoughts?
Hey, Dr. Ellis.
Hi.
Wonderful topic. And I come from a very a background in community-oriented, very busy general practice that,
Yeah.
tried their best to use integrative practices where they could. But so my question for you, do you feel like do you see some staff or that you would not, or I guess, are you selective in who you feel is qualified to follow those directions?
Yeah, absolutely. I mean, I enjoy teaching, so I'm willing to show anybody who wants to learn. I try to keep it to like potentially RVTs or assistants with a lot of experience to do it.
Hmm.
Or just having these like less experienced assistants watch for a while. And I try when I think about it, hey, feel this. This is how you palpate the elbow. This is how this needs to be, even when we're not doing a shockwave treatment, just to get everyone more familiar with anatomy. But I do usually save actual treatments for the more experienced staff.
Great. That makes a lot of sense, and that
Yeah.
is that's an apprehension that I had. But the application of this in general practice is really, I can't believe it. Uh, so another question would be, do you
Yeah.
have any sort of like, do you guys do you internally follow up on the treatments? Like, do you have some sort of protocol in place to see how how patients are progressing or anything internally, or if staff are still following guidance?
Yeah, usually it's kind of like a general protocol. We have like a flow sheet of I write down recommendations of when I want a recheck or a follow-up call. So that usually falls on my plate to say, hey, how's this going? And that's, I think, maybe something that could be easier with the blocks. Like, okay, this is our shockwave block. This is who we treated last week. Like, where do we need to follow up on those patients? But usually it's me putting in my notes that we either need to call or perform another treatment in X number of days.
So,
I
yeah, that makes
always
sense.
I always thought of calling the day after, and I think the second day after is much more valuable when I think
Yeah.
about it.
Yeah, usually they're sore. So I don't, I kind of, if we do it the day after, sometimes people are disappointed, but usually by the second day, they're feeling okay.
Yeah, I mean, I clearly try to avoid the soreness, but
Yeah,
I think you have a
always.
better idea of what's going on the second day. I always ask people to make a follow-up call afterwards, but I think I can stress or suggest day two instead of day one. So
Yeah.
definitely. Cool. Very, very interesting. I actually have all God's creatures or somebody who just reached out to me about all of this
Awesome.
on my list to get back to, and I just did an install in Nevada that was general practice. So
I
and
hope
we're
it's emerging.
getting
I think it's so valuable.
yeah, and I think we're getting there. It's just baby steps, I tell myself.
Yeah, absolutely.
So, no, I super appreciate your time. And we're sorry we missed you at Western. Are you going anyplace else this year?
Not on the docket for now, but we'll see where the year takes me, huh?
Where the year takes you.
Uh,
On
Hello. Hi,
Hi,
Katie. Thank you for thank you for this meeting. We are
thanks for
here
listening.
in the vet clinic, and we are with vets, assistants, and technicians. So I have a question regarding like, are you using laser and shockwave and at the same time, the same day,
I
or is something that you don't recommend to do?
I usually start them separately, like working further into cases. I have no problem doing them on the same day. A lot of times I'll separate them, especially to start because I want to know what's working. So if if I'm shockwaving and lasering a knee and the dog's getting better, I want to know which one. And I really try to only treat as much as I need to. Obviously, like I understand that veterinary medicine is expensive and can be cost prohibitive to a lot of people. So I always try to start with one or the other. And I use shockwave a lot more than laser. But sometimes I think a lot of people recommend spacing them out by a day. I don't do a ton of cases where I do both, honestly. So I, at least to start, will do them separately. But if a patient comes in and it's a 15-year-old dog and has to be lifted in and out of the car or needs to help him up harness and this is their treatment day, like I'm going to treat it in every way that it needs to be treated.
Yeah, my question is because both work in different pathways.
Hmm.
Like shockwave is doing like more micro traumas in the skin and
Hmm.
bones and ligaments and everything that you want to treat, and is bringing inflammation to bring more growth factors and cells and stem cells and all that good stuff that we have in the body.
Hmm.
And laser, if doing the opposite, like is decreasing the inflammation, is like relaxing the muscle. Like I know that is depending the setting that you use, but I don't
yeah,
think is we have a dilemma here.
We,
So that's my
no,
thought, and I don't know what you think.
I can interject from our standard a little bit. So I don't mind either way, honestly, but we really are trying to avoid the inflammation phase. That's kind of an older model of shockwave. So if you are using a little bit of a lower energy and stuff, and we don't need, if it's working through mechanotransduction, we don't need that inflammatory pathway anymore. Even if you hit the inflammatory pathway, that's not where the shockwave now we believe is getting its major effect is by moving the cell in the cell membrane and signaling through the nucleus the anti-inflammatory effects. And if now you can pull some of the more recent papers and they're going directly to anti-inflammatory and skipping the pro-inflammatory phase. Does that mean you want to use them both at one time? I call that a doctor's decision for sure. I do have one of the ways I personally like to look at it is that the shockwave brings stem cells in, and we know that. And so I tend to suggest, again, doctor's decision, shockwaving the primary issue, and then using the laser for more of the secondary pain associated throughout the body. Does that make sense at all to you guys?
Locations, right? Different locations, right?
Yes.
Yeah, like I'll treat like an elbow with shockwave because that's how I treat my arthritic elbows, and maybe some of the supportive, like tense muscles, like shoulder muscles and things like that. Laser is really helpful.
Contralateral limb, for example. Yeah.
I will say, like Dr. Taraka does shockwave and laser together when needed. And I've discussed, some people feel that it's drawing its mechanism from a different level of tissue, like the shockwave's specific and deep, and the laser is more surface and broader. There's no right or wrong. I think it's a decision that you guys have to make based on your patients. Is that a fair assessment?
I'm just turning the video on so you can see us. We're all here. We ate dinner together. We've had a lovely time. But hey, Cindy, it's Karen Reddick. Nice to see you again.
I'm Gabby.
That's Gabby. She's the one with the funny accent. I have the normal accent.
Yes.
Hey, Katie, you said you're from Southern California.
That's right.
We're in Northern California. What are you charging for the shockwave?
We're like averaging between $200 and $300 a treatment.
Oh, wow. We're low.
Yeah.
And we're cheap. We do 100. Well, it depends. If we're just doing one location, like say an elbow would be 100. And then we charge 150 per 15-minute session if we're doing multiple locations.
Yeah.
Sounds like maybe we could go a little higher.
You could probably go a little higher.
Yeah, as long as we do recommend often those are the numbers we recommend to start with, because we want you to use it all day, every day.
Yeah.
But the world is changing. Like, if people are accepting it, I would definitely go up, gradually go up for sure.
Okay.
Where was I? In Nevada, they started off at $350 and they weren't getting any use.
Yeah.
In a very holistic place. And I suggested going back down to get it used more. What do you guys charge for your laser?
Again, we're probably a little on the cheap side. We charge $35 per location that we laser. Okay. So we started as just a holistic practice. We incorporated a rehab that's kind of on the fence if we're keeping it right now, just due to profitability and finding the right veterinarians. And I'm not rehab certified, so it's like out of my wheelhouse. It makes me nervous. If my rehab vets leave, then I'm in trouble. So we're in that situation where our rehab vet is actually leaving and we're trying to replace that position. So we've had the laser forever. I've had that for 15 years. And I don't know, did I get the shockwave maybe 2 years ago, I think?
Yes, I think.
I had no idea what I was doing, but it always made the animals better. And the reason I got it was I had a running injury, a hip injury, and it was Shockwave that got me better. And I said, instead of paying for Shockwave, I'll buy one for the practice, treat myself, and then just start treating all the animals. And they just did so great that, we use it often. But actually, this talk was really good at making me think about, it tends to be, they're really painful, I should start incorporating it. It should be in a maintenance program, even a once a month, like you said, these lumbosacral cases or these chronically tight hip flexors and hips and pelvis and, lumbosacral, that sort of area. I tend to use it on my elbows where acupuncture's not cutting it. Nothing's cutting it. They're lame and then I pull it out, or I'll do it on stifles, partial tears, or sore backs. I mean, it's just so great for that. Any sore back, that acupuncture's not getting us all the way there. But and listening to this, I'm realizing I should be incorporating it all the time. I mean, being holistic, a lot of people come to us because they don't want to use medication. And so we're doing a lot of, boswellia, turmeric, Chinese herbs, electroacupuncture, aquapuncture. We do bioresonance therapy, things like that. But yeah, this has been super helpful at making me think of we should be adding it in a lot more, especially at our price point. It's not that.
Yeah, so you could be doing it all the time.
Yeah, I should be doing it way more often.
So you charge that for 2 times a week?
That's per session. So yeah, usually again, depends on how many joints we're treating.
Because the pet, the dog usually is with sore for 2 days. So you convince the people to, keep coming, even if they are not seeing that the pet is
well, if your pet is sore for 2 days, I would recommend turning your energy down.
Yeah, I almost never see sore patients, to be honest.
It should
very
be
rare for me.
Very rare.
What is the intensity that you are using? Because we know that the therapeutic settings is between 3, 4, or 5, right?
Yeah.
So we usually start with 1, and we see that some pets even tolerate a little bit the 1, right? But we try to, make them go up because we want to get, the therapeutic.
So what I want you guys to take into effect or kind of read, if you take our 2 shoulder papers, Julia Tomlinson's was done at 0.1 to 0.17 for tendinopathies, and it's a stronger paper, and she's very literature. But if you look at Dr. Owens, and Dr. Owen taught me, she uses the intensity of 0.03 millijoules to 0.6 millijoules.
We cannot do that with our machine. It's just going the entire number up.
No, I can teach you.
Yeah.
No, you can. So if you do you have a touch with a touch screen?
Yes.
Okay, so if you go along the top row, there's a button that takes it from 0 to 0.9, and you can put the decimal points in. So if you want, and I usually start and I was speaking millijoules, but I usually start most of my patients at an intensity of 0.6. But it both work, okay? But if you have patients that feel like they're sore and owners aren't happy with that, and I tell as general, if you do your 2-day follow-up and the dog is sore, to make a note and go down the next day, the next treatment. Does that make sense, Dr. Katie?
Yeah, makes sense to me. And when I'm doing the treatments, I try to gauge it a lot on how the patient's responding to treatment. If they're starting to get bothered, if they're turning around a lot, if they're moving away from me, because I'm trying to think, I usually start at 1, unless it's something tiny and really sensitive. And then I gradually increase each treatment. So I never, I think most of my LS dogs, I don't ever go over 4. but I've done some big dog hips at like 6 or 7. And I always start low and say that there might not be huge differences the first time, but I gradually increase with every treatment. But I almost never see soreness, and maybe I'm just lucky.
No, I mean, and we also have to keep in mind when we talk about, which is a constant conversation for me, when we talk about pain and soreness, every brain is different, right? So we're talking about what's the brain's perceiving, not what the nociception's happening in the tissue. And so it is really hard to estimate or think of in the first couple treatments for sure, because every animal is different. Just like each one of you can put your finger on it at 0.6 and will jump and scream at a different level.
I
Or
mean, I
say
have
some
shockwave on my back, and number one, I feel like very weird sensation, and it's painful, right? And I know that I have an injury in my back, but we have patients with injuries as well.
Yeah, well, I would try to go lower. I mean, it's something to play with. I'm not, as long as you're getting clinical results, that's the most important thing, right? And there is 100 ways to get clinical results. But I would, play with it. Play with the idea of using 0.6 instead of 1, or I mean, I have some I go down to 0.1 or 2.
So the idea is get the patient comfortable with the
Mhm.
higher intensity that we can. So we
No, no, no,
don't
no,
know
no.
if it's comfortable, if the patient is
Yeah.
comfortable. Right.
So the idea is for me and for what we've moved to over time, again, every single time life changes, right? And we're evolving. So what I want to know is that the patient is feeling the therapy. So I want that little look back. I want them to say, I feel that. I don't want them to pull their leg away. I don't want muscle fasciculation. I want them to look back at me. And typically, when I do a demo, they look back at me and kiss me in the face.
Okay.
But I get positive results, believe it or not. So, it's not right or wrong. It's just a suggestion to play with.
So if you get sore the next day, is because it was too much, or we expect to have sore the next day and then no.
Sore the next day means, for me, turn the energy down.
Okay, that's good. Okay.
It's, there's two schools of thought normally. There's academic, which is going to use the literature values, which they do get sore with, which is 0.1 millijoules to 0.15. And then I find there's a holistic, more gentle group that is down in the, very low energy range, but they both get results. Is that fair to say?
All right.
It's
Thank you.
something to play with,
A lot of practice, I feel like, and yeah, seeing how different dogs respond for sure.
Yeah, we try to understand because we want to make the treatment, get a result. But at the same time, we do a lot of acupuncture, and we know that the next day after acupuncture, the pet is feeling tired, or because the body is receiving the needles, and we are activating all the everything like the immune system, and so it's normal. But we thought that was normal to get sore the next day after shockwave. That's that we want to understand if we are doing too much for the animal, or we are doing too little, and we thought that we are doing right things, but we are not getting the effect that we want in the patient, right? So that's the delicate line that we have to understand, I think, because we are very new with this machine. So yeah, so that's the thing. For your explanation.
Yeah, and play with it again. And also, when you just, even if it's your own dog or a staff dog that has some crunchy joint, right? Pick that dog, flex and extend that joint, shockwave it very, very lightly, and then flex and extend that joint and see what you feel. And that will tell you, because most of the time when I do that, if it's a crunchy arthritic joint, if I don't change the range of motion, I at least change the end feel. And that means it was an effective treatment. Like that's kind of the way I teach people to convince themselves that it's effective, right when they're treating. Does that make sense?
Yeah.
My dogs were definitely my guinea pigs to start. And they're my guinea pigs to teach staff anatomy too, because, they can take it. They'll be fine. But practicing on your own dogs, I think, is very helpful.
Yeah. Well, and for me, I had to convince myself. So for me to convince myself that it was an effective treatment, if I had a change in range of motion, I changed something. Now, is that change in range of motion going to stay for a long, long period of time? Probably not. It's probably an initial result that might tighten up over a few days. And just like arthritis, it'll get better each time I treat them. But it is a nice way to be like, yes, my targeting worked, damn it. So.
Yeah. I mean, that's what convinced me completely was my dog on the video. Like, she was having a hard time getting up. She couldn't walk upstairs anymore. She couldn't get on furniture anymore. And after her first shockwave treatment, she did. It's like, done. I'm sold.
What about acute intervertebral disc disease? Do you ever use that on low intensity?
Yes.
Yes, I have not. I've used it like paraspinal a little bit, like not really on post-ops on some of my like medically managed ones.
What about those ones that don't go to surgery?
I do a lot of acupuncture on those, honestly. So Cindy probably has more experience with that than I do.
If I use it extensively on anything that is weak behind, or I've seen a down dog that still had deep pain start to move again by merely hitting the peripheral nerves coming off the spinal cord.
I've got one right now that had an MRI. The parents have decided not to go to surgery, so we know exactly where the lesion is. We have deep pain. We potentially have some withdrawals. I mean, it's very borderline, but the dog's not walking, obviously not walking. And we're getting to the point that people are, because we're 10 days right now. And I said, we really need to give this dog a month, in my opinion, before we pull the pin. And we've done NSL injections. We're doing twice a week electroacupuncture. We're doing aquapuncture, laser twice a week. Yeah, Chinese herbs. And yeah, I'm just thinking if we just dial it down low to not create inflammation, but use it in an anti-inflammatory capacity, that maybe this will be helpful to this dog.
I mean, I have seen a dog get up and start to actually move its legs in the cart when it wasn't moving its legs at all. Immediately post low energy shockwave. Perhaps one thought would be, I mean, you're doing a lot, and how much can the cells react to, et cetera, et cetera. One thought would be for a couple of times swapping out the laser for shockwave.
That's what I was thinking.
Yeah.
Well, I have a bet with the neurologist. I'll get this dog walking for a bottle of alcohol.
You got this. You've totally got this.
So I have to pull something out of the bag, because I was a bit of a smart ass when I texted him and I said, you want to bet I can get this dog walking? And I'm like, today, not really much better. So, yeah.
No, if you read it will be up probably in a week or two. I have a blog I'm writing on the peripheral nerve, the effect of sorry, I'm tired. The effect of shockwave on peripheral nerves. And it's clear, from animal model systems that you regenerate peripheral nerves with shockwave. So if you can get to those nerves as they come out of the dorsal horn, you have a huge chance of regaining some function.
Great.
So you say follow the leg, like follow the peripheral nerves through the spine to in the legs, right?
No, I just come right where it comes off the cord.
Oh, okay.
So I always, when I treat backs, I put my index finger on the dorsal spinous process and
Yeah.
move off that by a centimeter or 1.5 centimeters, depending on the dog. And then I want to try to get deep enough to the disc where the nerve is coming out of the, so I need to get deep enough. If you're not deep enough, I don't think you get to the actual nerves. Does that make sense?
Yeah. So which number do you use? Like 20, 30 millimeters?
Depends on the size of the dog.
Yeah.
The French bulldog, of course.
There's no surprise there.
I probably wouldn't go as far as a 30. If he's a muscular dog, I'm gonna guess.
It loses everything.
I'd say 20 maybe.
Yeah. I mean, you have the whole length of the focal zone, right? I'm trying to put the red dot on the nerve, but you have the whole length. So, it's worth trying a 15 and a 20,
Well, you have job to do.
Yeah.
I want to follow up on this. I want to hear about it.
Yeah, I have to win. I can't believe it. So he opened up below us, which is why we opened Rehab. He's a 3-doctor neurology only practice. And I'm friends with him because he removed a brain tumor from my cat. And I said, what about if I put Rehab in? He goes, that'd be great. And then referred nothing to us.
Oh, come on.
Yeah, I was like, God. So when this dog came in, he didn't refer it up to us. The client knew me already and brought the dog in. He said, you know, he didn't even refer to you. I said, that does it. So I'm texting him. So I've got to get him walking.
Got to win. You can do it.
All right, I'll start sending the cases up to you. But anyway.
Well, you can put a big sign or flyer on his desk, on his front office.
Yeah.
Posted to his window.
There you go. Yeah.
But just things to think about. Again, I don't want to say any way is right or wrong because there isn't, but just things to think about.
Mm-hmm.
Good. Thank you.
Yeah, thanks for listening.
Anybody else? Cool. Well, I thank everybody for their time and input, and very, very useful. And thank you, and have a great night. And I'm going to get dinner.
You got it.
Take care, everybody.
Thank you. Have a good night.
Bye.
Bye.
Thanks, Dr. Ellis.
Thanks.